Hi, my name's Allison Mooring. I'm a nurse here at UHC in the ICU. Today we will be talking about the Altrix temperature machine. It's used for cooling our patients. We use this for the hypothermic protocol, also just cooling patients. So we need to start by familiarizing ourselves with the machine, but first off, you need to make sure you have a physician's order. Always check your order and make sure that it's correct and that it does call for use of this machine. Alrighty, so what we need first is our order. That was already checked, so we're going to make sure that we have our supplies. They do have a couple of different supplies. Today we have the body, the chest blanket, and the 2 leg garments, which actually wrap the patient. There is just a cooling flat blanket that we do have as well. You need sterile water, and you need to have your temperature probes. They have here 2 different kinds. We have an esophageal and a rectal, and then we have the bladder, so your choice. So just to familiarize yourself with the machine, there's always the instructions here on the machine if you need it, your power button. On the back of the machine, you have the temperature probe connector. You will connect here into the first slot, and you have 3 places for hoses. If you're using 2 garments, then you can use 2 hoses and disconnect the other hose. You also have your reservoir on the back for the water. It must be sterile water. So let's get started. We'll power up the machine here. I have plugged my probe in. We will choose the esophageal and the rectal probe. Now here on the screen, I don't know if you can see, but zoom in if you're at home or on a bigger computer, whatever. And it tells you to select the mode. So when we're doing cooling, you want to always do automatic. So we chose automatic. Next, it asks us to make sure the probe's in, and it has detected the probe. So now it's just getting itself ready. These supplies can be gotten from from our SPD. Here on the screen, it will show patient A, and that's what we are connected to. So once it is ready, we will, it'll prompt us to choose what we want. So right now it is saying that our current temperature, so we're going to confirm our current temperature. And we need to select the patient's target temperature. So depending upon your order, that's what you will choose. Make sure you look in the chart to see what the doctor's ordered. You go up and down, choosing whatever the temperature is that they desire. You're going to hit next. And anytime you're cooling, you want to hit the max cooling. You will confirm that, and it will start cooling the patient. I will show you this. These are thrown away after each patient. If your patient needs cooling at a particular time, you'll use this. Don't throw this away. It can always be reused on that same patient. Alrighty, so you will, under here you have the little connectors, and on the back you have your hoses. You will connect in. And this will fill with water and start to cool the patient. They have the leg ones as well, and you will do the same thing. on that as well. You need to make sure that you're documenting in Cerner or your electronic medical record that the time and date that it was started.
Employees and staff.
The
fire alarm system will be in test until further notice. Attention, hospital employees and staff. The fire alarm system will be in test until further notice.
Alright, you need to make sure that you are charting the date and time that you started this therapy. Also, temperatures need to be charted. They do not cross over. So that is very important. You want to make sure before starting this, you're paying attention to your patient's skin and checking that every hour when you're doing your rounding with your patient. If you notice anything, any abnormalities, you need to stop treatment and call the doctor immediately. If you have any other questions, you can get in touch with our education department. And that is it. Thank you very much.